Kenya on Tuesday night received the first consignment of the COVID-19 AstraZeneca vaccines amounting to 1.02 million doses, setting the wheel in motion for the planned rollout across the country. But what are health experts and the civil society saying about the vaccine? Our current affairs reporter Dickens Luvanda held talks with infectious disease expert Dr. Moses Masika and Haki Africa Deputy Executive Director Salma Ahmed and prepared for us the following report.
There are a lot of myths surrounding the COVID-19 AstraZeneca vaccine that was delivered in the country on the night of Tuesday, March 2nd, 2021. Even though Kenyans expect the administration of the jab to kick off after the vaccines are distributed from the Central Vaccine Storage Site in Kitengela, Kajiado County, and the official distribution exercise at the Kenyatta National Hospital, many of them are skeptical about taking the vaccine. Human rights organization Haki Africa says the government has failed to conduct civic education about the vaccine, leaving Kenyans in the dark.
Kama shirika la Haki Africa, kwanza tunapongeza serikali kwa kuweza kufikisha vaccine hii katika nchi yetu. Vile vile pia tungependa kuhamasisha jamii kuambia kwamba hili si jambo baya iwapo kuna tiba ambayo imeweza kutuletea. Lakini pia tuko na tashwishi kwa sababu wananchi hawajajuzwa vilivyo kuhusiana na athari na pia manufaa ya hii vaccine. Wanafaa pia waelezwe kama vile ninavyosema kwamba once ukishapewa ndio it means ni once and for all. Hii ni ugonjwa hautakushika, ama ina to boost immune kwamba utakuwa una chances low, ama it means kwamba wewe you are now resilient to COVID-19 completely.
The organization's Deputy Executive Director Salma Ahmed argues that neither persons with underlying conditions have information about the vaccine and how, where or when to get it and what cost.
Anything ambayo inakuja katika nchi na ni jambo geni ambalo linahitaji ushuru wa umma ni lazima kwanza kufanywa civic education. That is a common process. Lolote jipya tunaelewa kwamba wakati wa pandemic serikali haikuwa na muda mwafaka ya kuweza kuhamasisha jamii. Hilo ni jambo ambalo linaeleweka wazi, lakini sasa hili ni jambo ambalo lilikuwa lina mpangilio. Tulikuwa tunajua kwa hii sindano itakuja, tunajua kama tunaitarajia. Mbona tusihamasishe watu na mapema?
Dr. Moses Masika, an infectious disease expert, however, advises that Kenyans should not be afraid to go for the jab, allaying fears that the vaccine may not be 100% viable, given the shortest time it was developed by the Oxford University in the United Kingdom.
Already the vaccine has been given to millions of people in the UK and Europe and other parts of the world who have and that information is being collected to inform the safety of the vaccine and the efficacy as to whether the vaccine works. And we can see that the vaccine works. It does prevent people from getting sick. The studies were showing that 8 out of 10 people who got the vaccine were prevented from getting sick. And even the others who got the vaccine may not necessarily need hospitalization if they get sick. So the vaccine works, and we know that the vaccine is safe. It does not have any severe side effects. That's not to say that there are no side effects. Like many other vaccines, this vaccine also has some side effects, but the side effects are much less of a problem compared to COVID-19, because we are talking about a headache, we are talking about fever, of course pain at the site of infection, we are talking about joint pains, and these are things that will resolve. They will go away after a few hours or maybe 1 or 2 days, and then the person is protected. And this is not unusual for vaccines.
We will also begin a proactive process of ensuring that this vaccine is also going to be able to be available to people across the continent.
On Thursday, President Uhuru Kenyatta flagged off the national distribution of the COVID-19 vaccine at the Central Vaccine Depot in Kitengela, Kajiado County, where he said that those being vaccinated in the first phase will not pay a single cent for the jab.
One of the issues I saw was that people were comparing the prices that private companies were offering to other countries and Kenya, or the price that Kenya will buy the vaccine at. I saw a clarification that the current vaccine was actually paid for by UNICEF. So the country will only distribute it.
Iwapo kutakuwa na hizi chanjo tunazozungumzia na zitakuwa kuna venye zitarecommend wale wenye kuingia ni lazima pia wazipate. Maybe it might be a help in terms of control, because tunaona kama hivi sasa tunasikia kwa nchi jirani Tanzania imechacha sana huu ugonjwa, na tukiangalia mpaka wa Tanzania na Kenya ndio umekaribiana zaidi in a way that hata watu wanavuka kwa miguu. So ikiwa tutaruhusu hiyo movement bado, we will go back to where the second phase has took us.
We have to have a priority list. We can't do everybody at the same time.
The quantity of the AstraZeneca vaccine for each county is determined by the number of the frontline health workers, especially after they were given priority in the administration of the jab. The initial distribution of the first 495,000 doses gives the Nairobi Regional Store the highest quantity of 138,000 doses, Kisumu and Nakuru regional areas 54,000 doses, Mombasa and Kakamega areas 42,000 doses, Garissa and Meru areas 21,000 doses, while Nyeri regional area 18,000 doses. Level 6 hospitals will receive 33,000 doses, while the military level 4 hospitals will receive 21,000 doses. The week beginning March 8, 2021 will be the first official first week of the vaccination exercise for Kenya, with the priority being given to healthcare workers, unlike other countries where heads of states have received the vaccines first. Dickens Rwanda, Hope TV News Watch.